I don't speak any Serbian, so I have no clue what was said before, and I hope you understand English. I'm very excited to be here. It's a very special day. We've had our soft opening of the Puls clinic a couple of months ago, and we've been overwhelmed by the success it has had in the past couple of months. And I have to emphasize, this is not just because we have an amazing concept, and of course the IT system is amazing. We have terrific partners, but what really makes this heart tick is the staff working in it. We have, of course, an amazing cardiologist, but please keep in mind, this is just a small part of the team. We have amazing nurses like Sanya and Leah. Ivana is doing a great job. Maya as a clinical assistant. This is what makes it work, and has also inspired us to start looking into other bigger cities, or not bigger than Belgrade, sorry, into other big cities to open additional clinics. At the same time, we realized that staff is a big issue, not just here, but everywhere. And also, the population is aging, which causes an epidemic of chronic diseases, especially cardiac diseases. So we need to be smarter. We need to be more creative into how we can keep our healthcare system sustainable and affordable for everyone. In the Netherlands, we've been working with an e-health solution for the past 5 to 6 years. We give patients an app, and with that app, they can upload their own biometric data, and we can analyze that data from a distance. And this causes healthcare to be independent of place and time. We can treat patients anywhere, regardless whether they're in a clinic or not. So, for example, if you've been diagnosed with arrhythmia, and you feel you have heart palpitations, how it would normally go is if you feel those complaints, you call, you make an appointment, and yes, we're ready for you. You can have your appointment as soon as possible, within 24 hours. I have one, thank you. But it could be too late in the sense that your complaints have already subsided. And you come to your cardiologist and you say, oh, I really had these complaints just a couple of hours ago, and now I'm here, and it passed. So, for example, this is a little device that we give to our patients. It's the same size as a credit card. You can take it with you anywhere, and as soon as you feel you have complaints, you can immediately check if it is your heart, yes or no. And I hear you thinking, if everybody is going to send ECGs all the time, how is that going to make you more efficient and make you need less personnel? Well, of course, we specialize in IT, and we have smart algorithms that filter out all the normal ECGs. So if it's definitely not your heart, the patient will also know immediately. And if it is not a normal ECG, our staff will analyze it, and if needed, we can adjust your therapy right away. Now, this is something we've been researching for years and still have 4 PhDs actively investigating how we can keep optimizing this, this e-health solution. So, for example, what they found was in patients with hypertension, there's a seasonal rhythm. And this means we can provide you tailor-made healthcare. You only need to take medication if it's actually needed, not because you got diagnosed once, but we can keep track of you and your values. And only if it's actually needed, you need to take medication. Also, our national health insurance system investigated how efficient this really is. And they found that in patients using our e-health solutions, the hospital admissions declined with 50%, and even ambulance transfer decreased with 70%. These are mind-blowing numbers. Patients have been extremely satisfied, and moreover, healthcare is more affordable this way, because you don't need all those clinics. You can treat patients from afar, and they only come to you if it's really needed, if they need additional diagnostics or if it appears they need an additional intervention. This is a great step forwards to value-based healthcare, and we're so excited to bring this to Serbia and to share our knowledge with you. And yeah, we hope to stick around for quite a while. Thank you.
Thank you. Thank you very much.